If you're dealing with burning feet, numb toes, tingling hands, or sharp nerve pain, I want you to listen very carefully right now, because what I'm about to tell you may genuinely surprise you. Most people believe neuropathy gets worse only because of age, diabetes, or irreversible nerve damage, something they've been told they simply have to live with. But in my experience, and in the growing body of research we now have, that's not the full story. In fact, many people are unknowingly making their neuropathy worse every single day, not because of what they don't do, but because of simple, everyday habits they do without thinking twice. These habits often seem harmless. They're rarely discussed in a typical doctor's visit, and there's a very real chance you might be doing one or more of them right now. Today, I'm going to reveal 7 surprising habits that can quietly worsen neuropathy over time, and just as importantly, what you can do instead. I strongly encourage you to stay until the end, because the final habit is one of the most overlooked causes of worsening nerve pain in adults over 60. Let's begin. Before we go any further, I want to quickly say this. Everything you're about to hear is for educational purposes only. It's not meant to replace medical advice, diagnosis, or treatment. Always speak with your healthcare provider before making changes to medications or treatment plans. With that said, let's talk about your nerves and why these habits matter more than most people realize. Neuropathy occurs when nerves become damaged or irritated. This damage can develop for many reasons, including diabetes, poor circulation, vitamin deficiencies, chronic inflammation, certain medications, and age-related nerve degeneration. To understand why everyday habits have such a powerful effect, it helps to think of your nerves like electrical wiring in your home. When the protective insulation around those wires starts to wear down, or when the power supply becomes inconsistent, the signal doesn't travel smoothly anymore. Instead, it flickers, misfires, or overloads. In the human body, that's when symptoms begin to appear. Tingling sensations, pins and needles, burning or freezing feelings, numbness, weakness, or sudden sharp electric-like pain are all signs that nerve signals are being disrupted. Here's the key point most people miss. Once nerves are damaged, they become extremely sensitive to lifestyle stressors. Small daily habits, things that seem insignificant, can slow healing, increase inflammation, reduce blood flow, and deprive nerves of the oxygen and nutrients they desperately need to recover. That's why 2 people with the same diagnosis can have very different experiences. One sees gradual improvement while the other feels progressively worse. Often the difference comes down to daily habits. Let's start with the most common one. One of the biggest surprises for people with neuropathy is how much sitting affects nerve pain, even in those who exercise regularly. Many people tell me, "But Dr. Kent, I walk every day." And that's excellent. Walking is beneficial. But it may not be enough if the rest of your day is spent sitting. Long periods of sitting, whether you're watching television, reading, driving, or using a computer, cause circulation to slow dramatically. Your nerves rely heavily on steady blood flow to receive oxygen and nutrients and to remove metabolic waste. When blood flow drops, oxygen delivery decreases, nutrient supply declines, nerve repair slows, and pain sensitivity increases. On top of that, prolonged sitting compresses nerves in the lower spine, hips, and legs, which can significantly worsen foot and leg neuropathy over time. Even short breaks in movement can make a meaningful difference. Standing up every 30 to 45 minutes, gently rolling your ankles, pumping your calves, or taking a brief walk helps restore circulation and relieve nerve compression. It doesn't require intense exercise. Even 2 minutes of movement can help reawaken blood flow. Neuropathy, quite simply, hates stillness. The more consistently you introduce gentle movement throughout the day, the more support you give your nerves. Another habit that quietly worsens neuropathy involves blood sugar fluctuations, and this one is critical even if you've never been diagnosed with diabetes. Many people assume that only chronically high blood sugar damages nerves, but research now shows that frequent spikes and crashes in blood sugar can be just as harmful. When glucose rises quickly after eating sugary or refined carbohydrate-heavy foods, nerves can swell, oxidative stress increases, and inflammation damages delicate nerve fibers. When blood sugar then crashes, nerves become energy-starved and pain signaling increases. This cycle creates instability that irritated nerves simply cannot tolerate well. These fluctuations happen most often with sugary snacks, white bread, pasta, rice, sweetened beverages, and large carb-heavy meals eaten on their own. The solution isn't eliminating carbohydrates altogether, but stabilizing how they're consumed. Pairing carbohydrates with protein or healthy fats slows glucose absorption and reduces spikes. Eating smaller, balanced meals instead of large portions helps maintain steadier blood sugar throughout the day. When blood sugar remains stable, nerves tend to feel calmer, less reactive, and less painful. Footwear is another surprisingly powerful factor in neuropathy, and many seniors unknowingly worsen nerve pain inside their own homes. Walking barefoot or wearing thin, unsupportive slippers may feel comfortable at first, but these choices can increase nerve compression, reduce shock absorption, and strain already sensitive nerve endings. Over time, this contributes to worsening numbness, burning, and pain, particularly at night. Neuropathy-affected feet need protection and support, not just softness. Wearing supportive shoes or structured slippers indoors can make a significant difference. Shoes with firm soles, proper arch support, wide toe boxes, and cushioned insoles help distribute pressure evenly and reduce irritation to sensitive nerves. For many people, this simple change alone leads to noticeable reductions in nighttime foot pain and discomfort. Another habit that often goes unnoticed is chronic dehydration. As we age, thirst signals become less reliable, and many adults over 60 are chronically dehydrated without realizing it. Water plays a critical role in nerve function. It supports nerve signal transmission, nutrient transport, waste removal, and inflammation reduction. When the body is dehydrated, nerve signals become more erratic and symptoms such as tingling, burning, cramping, and hypersensitivity intensify. Sipping water consistently throughout the day, rather than waiting until you feel thirsty, helps maintain proper hydration. Monitoring urine color, aiming for a pale yellow, is a simple way to gauge hydration status. In some cases, adding electrolytes may help, but this should always be done with your doctor's approval. Even mild dehydration can make neuropathy feel significantly worse, which is why hydration deserves more attention than it usually gets. These habits may seem small on their own, but together they create an environment where nerves struggle to recover. Neuropathy is rarely just about nerve damage itself. It's about how well or how poorly the body supports those nerves on a daily basis. When circulation improves, inflammation decreases, and nerves receive consistent nourishment, symptoms often become more manageable. When these supports are missing, nerve pain tends to escalate. What I want you to understand is this: neuropathy is not something that exists in isolation. It responds continuously to what you do every day. Sitting too long, allowing blood sugar to swing wildly, wearing unsupportive footwear, and staying chronically dehydrated all send stress signals to already vulnerable nerves. But the encouraging news is that these habits are modifiable. They don't require extreme interventions or expensive treatments. They require awareness, consistency, and small intentional changes. If you've been feeling frustrated or discouraged by neuropathy, I want you to know that improvement often begins not with drastic measures, but with addressing these overlooked daily stressors. Your nerves are constantly listening to your environment. When you create one that supports circulation, stability, hydration, and gentle movement, you give them the best chance possible to calm down and function better over time. As we continue exploring neuropathy in future videos, we'll talk more about additional habits, supportive therapies, and ways to protect nerve health as you age. But for now, start by paying attention to these foundational factors. Small changes, practiced consistently, can have a powerful impact. Your nerves may be damaged, but they are not beyond influence. How you live each day truly matters. One of the most sensitive, but also one of the most important topics when it comes to neuropathy is the role of pain medications. This is an area where many people feel conflicted, and understandably so. When you're living with daily nerve pain, burning sensations, or electric-like jolts, relief becomes a priority. Medications such as over-the-counter anti-inflammatory drugs, prescription nerve pain medications, and long-term pain relievers can absolutely play a role in managing symptoms. The issue is not that these medications are bad. The problem arises when they become the only strategy used to deal with neuropathy. Some pain medications can reduce nerve blood flow over time, which is concerning because damaged nerves already struggle to receive adequate oxygen and nutrients. Others work primarily by masking symptoms, meaning the pain signals are muted while the underlying nerve irritation or degeneration continues silently in the background. Certain medications may also interfere with the absorption or utilization of nutrients that nerves rely on for repair and maintenance. When this happens, the pain may feel temporarily controlled, but the long-term healing process can slow or stall altogether. This doesn't mean medications should be stopped abruptly or avoided altogether. They have a place, especially during periods of severe discomfort, but relying on them alone, without addressing circulation, movement, nutrition, and nerve support, can delay recovery and sometimes even allow neuropathy to progress unnoticed. The goal should never be suppression alone. The goal should be support. Using medication exactly as prescribed while simultaneously incorporating other nerve-friendly strategies creates a more balanced approach. Gentle daily movement helps restore circulation and prevents nerve compression. Nutrition support ensures nerves receive the vitamins, minerals, and energy they need to function. Nerve-friendly habits, such as proper footwear, hydration, and posture, reduce daily stress on already sensitive nerve fibers. In some cases, physical therapy can help retrain movement patterns, improve balance, and reduce nerve irritation. When these elements work together, medications become part of a broader support system rather than a crutch that carries all the responsibility. Another habit that quietly worsens neuropathy for many people is poor sleep positioning. Sleep is supposed to be restorative. It's one of the primary times when the body repairs tissue, regulates inflammation, and restores balance to the nervous system. Yet many people unknowingly compress their nerves for hours at a time while they sleep. Curled legs, prolonged pressure on elbows or wrists, sleeping with the feet pointed downward, or heavy, tight blankets that restrict circulation can all place stress on vulnerable nerves throughout the night. When nerves remain compressed or deprived of circulation for hours, symptoms often show up first thing in the morning. People wake with numbness, increased burning, stiffness, or sharp pain that wasn't as noticeable the night before. Over time, repeated nighttime compression can worsen overall nerve sensitivity and prolong flare-ups. Many people assume morning symptoms are just part of aging, but often they're a sign that nerves are being stressed during sleep. Making small adjustments to sleep positioning can significantly reduce this burden. Using pillows to support joints helps prevent excessive bending or pressure on nerves. Keeping the feet in a neutral position rather than pointed downward reduces strain on the nerves running through the ankles and feet. Being mindful of arm and leg placement helps avoid prolonged pressure on sensitive areas like wrists, elbows, and knees. Even loosening heavy bedding to allow freer circulation can make a noticeable difference. Nighttime is when nerves attempt to repair themselves. Supporting that process rather than sabotaging it can change how you feel throughout the entire day. Perhaps the most underestimated and overlooked habit of all is chronic stress. This is often the hardest one to address because stress doesn't feel physical at first. Yet its effects on neuropathy are very real and very direct. Chronic stress raises cortisol levels, which in turn increases inflammation throughout the body. It reduces blood flow to the extremities, prioritizing survival responses over repair. It also heightens pain perception, meaning the brain becomes more sensitive to nerve signals that might otherwise be tolerable. Stress doesn't just affect the mind. It sensitizes nerves at a biological level. That's why neuropathy often feels worse at night, during emotionally difficult periods, or when anxiety levels are high. Many people notice that their symptoms flare during stressful events, even if nothing else has changed. This isn't all in your head, it's the nervous system reacting to prolonged strain. When the body remains in a constant state of alert, nerves have little opportunity to calm down. Pain signals become louder, more persistent, and more intrusive. Over time, this can create a cycle where pain increases stress, and stress increases pain. Breaking that cycle doesn't require drastic measures. Gentle breathing exercises help activate the body's relaxation response. Daily relaxation routines, no matter how brief, signal safety to the nervous system. Light stretching releases tension and improves circulation. Mindfulness, prayer, or quiet reflection can help regulate emotional stress. Reducing stimulation before bed allows the nervous system to settle rather than remain overstimulated late into the night. A calmer nervous system almost always translates into calmer nerve pain. This is one of the most powerful yet underutilized tools for managing neuropathy, especially in older adults who may already be dealing with multiple stressors. When we put everything together, a clear pattern begins to emerge. Neuropathy is rarely worsened by one single factor alone. Instead, it's the accumulation of daily habits that either support nerve health or slowly erode it. Sitting too much restricts circulation. Blood sugar spikes irritate nerves. Poor footwear increases mechanical stress. Dehydration disrupts nerve signaling. Over-reliance on pain medications masks symptoms without addressing root causes. Nerve-compressing sleep positions interfere with nighttime repair. Chronic stress keeps the nervous system in a constant state of irritation. The good news is that none of these habits require extreme treatments to change. Improvement doesn't usually come from one dramatic intervention. It comes from small, consistent adjustments that reduce stress on nerves and improve the environment they live in. Better circulation, lower inflammation, improved nutrient delivery, and reduced mechanical pressure all give nerves a better chance to stabilize and, in some cases, heal. If you've ever been told that there's nothing you can do about neuropathy, I want you to hear this clearly. That simply isn't true. While nerve damage does take time, your daily habits play a far greater role than most people realize. The earlier you identify and remove these hidden stressors, the better chance your nerves have to calm down and function more normally. Progress may be gradual, but it is often very real. If this video helped you understand your symptoms in a new way, I encourage you to share your thoughts in the comments. And if you'd like more videos focused on natural nerve support, circulation, and aging well, make sure you're subscribed. Take care of your nerves, be patient with your body, and I'll see you in the next video.